To Queen's Park, where question period is underway. We'll take a live listen in.
Healthcare services that are currently publicly delivered.
And to reply, the Deputy Premier and Minister of Health.
Speaker, thank you for the question, and allow me to clarify or to repeat what I said yesterday, which was in Ontario, you use your OHIP card to access healthcare services in the province of Ontario, and that will continue.
Supplementary question.
Thank you. Well, that was hardly a no. Speaker, again to the Minister. Reliance on private healthcare providers will plunge our public hospitals and healthcare systems deeper into crisis. Bill 124 is draining staff from the public system, and private staffing agencies are gouging hospitals. Will the Minister allow private healthcare companies into Ontario, siphoning doctors, nurses, and healthcare workers out of the public system?
To reply, Minister of Health.
Thank you, Speaker. To be clear, Ontario has one of the strongest publicly funded healthcare systems in the world. It is world-renowned, first class. It's second in terms of how much we spend on publicly funded healthcare. That will continue in the province of Ontario. What I referenced yesterday was innovation. We should not be afraid of innovation. We do it very well in the province of Ontario, and we will continue to work with our partners to make sure that that innovation is encouraged and can continue. Thank you, Speaker.
And the final supplementary.
So I take that as a yes. Again, to the Minister. Private corporations have a financial responsibility to generate profit. That's a direct conflict of interest with their responsibility to offer affordable, accessible, and high-quality care, regardless of the patient's ability to pay. Does the Minister think patients should have to start paying for care they now receive as of right?
To respond, the Minister of Health.
No, no, no. OHIP cards are used in the province of Ontario to fund publicly funded healthcare systems. That will continue under our watch. There has never been a change where we will continue to fund OHIP services through our healthcare system. What you are worried about unnecessarily is that we would be encouraging innovation. And there are many examples of innovation that are happening in the province today that we want to expand, not the least of which are examples that with Ontario OHN, Ontario Hospital Network, and Sick Kids, and many others, which I'm happy to highlight if the member opposite is not aware of that innovation that is happening in the province of Ontario today.
I'll remind members to make their comments through the chair. The next question. Yeah. Member for Toronto Centre.
Thank you. Thank you, Speaker. My question is for the Premier. Just 2 days ago, I received a letter from a nurse in my riding. He shared a story about one of his patients. My patient has fluid filling up in his lungs, and he's less able to breathe. His oxygen is not coming into his body with each passing day. It's not an exaggeration to say that he is drowning slowly. He needs an urgent procedure to remove the fluid. This should have happened last week. It was scheduled for last week. It has not happened because of the staffing shortage. My question, what will the government do to help this suffering patient in the next 24 hours, and what will they do in the next 10 days to alleviate this staffing crisis that we see in our hospitals?
Minister of Health.
Thank you, Speaker, and welcome to the member opposite to her new role as a parliamentarian. You know, there is no doubt that staffing challenges impact patient care, and that is why we have been working proactively to make sure that where we need those services, we have them. We've worked with Ontario Health to, for example, ensure that if an emergency department is at risk of closure, we work with Ontario Health to make sure that physicians who are prepared and willing to travel to other jurisdictions have that opportunity. They may travel for a couple of hours to go to a hospital network that they're not traditionally tied into. We've done that work. We need to do more of it, of course, but I want to reinforce that we have done a lot already. We have 10,500 new healthcare professionals working in the province of Ontario that we did not have without the innovation and the proactive approach that we have taken as a government.
The supplementary question.
Thank you, Speaker. Back to the Premier. With respect to the question I had was really about what are you going to do in the next 24 hours. So my constituent further invites all of us to consider this. Reflect on what it would be like to be unable to breathe during every single breath that you're drawing. Please think about what it's like when your lungs are filled with water. Reflect upon that. Speaker, no one in the Ontario hospitals should have to experience that agony because they are waiting for an urgent procedure. My question again is, will this government listen to healthcare professionals and to implement the solutions that are needed to address the healthcare crisis and this understaffing crisis in our hospitals?
And the Minister of Health.
So again, through you, Speaker, we of course have provided additional funding to hospitals to ensure that their emergency departments and other backlog surgeries can proceed in a faster way. In some cases, that involves additional funding to allow those surgery suites to be open longer into the evening, over the weekends. That kind of innovation, those kinds of investments mean that we can deal with the backlog and get through the number of people who are waiting for these critical services. We'll continue that work. We'll make sure that as hospitals, as medical practitioners need the support, they will get it. They have the province of Ontario and the people of Ontario supporting them in that role. Thank you.
And the final supplementary.
Thank you again, Speaker. This issue is not related and restricted to just one patient or one hospital, as we all know. Another constituent of mine, Gregory, needs urgent abdominal surgery. But because of the surgical backlog that we've already heard a lot about, he was told to find a doctor outside of Ontario, never mind outside of the city or in another neighborhood. He called my office to say this: do you really think anyone in my condition is ready to find care outside of the province? Speaker, healthcare workers have told the government how to clear the surgical backlog, hire 30,000 nurses, repeal Bill 124, and fund public health care at the rate of inflation. Will the government put these recommendations into action, or are they really just setting up the excuse for privatization?
Minister of Health.
Thank you, Speaker. You know, as part of our plan to reopen, we've actually expanded by almost over 1,000 beds in ICU capacity. It means that things like the surgery backlog can be dealt with proactively. We understand that there are many challenges that have happened as a result of individuals who could not access their primary care practitioner, who didn't have the ability to get that diagnostic imaging. We have now essentially eliminated the imaging, the backlog that we've had in the diagnostic piece. We're working very well with our healthcare partners to make sure that we focus as equally on the surgery backlog. That work will continue. But in the meantime, I think it's really important for people to understand that a lot of this work happened because we understood we needed the capacity in the province of Ontario to be able to stay open and to continue to serve the people of Ontario. Thank you.
We were listening live to question period underway this hour inside Queen's Park. Opposition calling on the government to scrap Bill 124. Minister Sylvia Jones, though, saying the government is considering all options on the table, including privatization of the healthcare sector, calling that move innovative.